Niacin, particularly in the form of niacinamide, also known as nicotinamide, has shown remarkable yet underrecognized potential in improving joint health, reducing inflammation, and enhancing mobility in individuals suffering from osteoarthritis and certain autoimmune conditions like rheumatoid arthritis. While the spotlight in rheumatology has long shifted toward biologic therapies, targeted drugs that modulate specific immune pathways, the quieter, simpler intervention of niacinamide has faded into obscurity. This shift has less to do with efficacy and more to do with systemic biases in modern medicine, where older, low-cost therapies are routinely overshadowed by patentable, high-profit pharmaceuticals. Back in the 1990s, clinical research, most notably led by Dr. William Kaufman and later followed by Dr. Robert Kaufman and others, explored niacinamide's potential in treating degenerative joint conditions. These studies reported significant improvements in joint flexibility, reduced inflammation, and even lower dependency on NSAIDs, nonsteroidal anti-inflammatory drugs. Participants experienced not only symptom relief but also enhanced range of motion, often without the gastrointestinal and cardiovascular risks associated with long-term NSAID use. The mechanism behind these benefits is rooted in niacinamide's anti-inflammatory and cell-regulating properties. Unlike niacin, nicotinic acid, niacinamide does not cause flushing and is better tolerated at therapeutic doses. It works systemically by supporting the production of NAD+, which fuels enzymes involved in DNA repair, cellular stress responses, and immune modulation. More specifically, niacinamide appears to downregulate pro-inflammatory cytokines like TNF-alpha and interleukin-1 as well as reduce circulating levels of C-reactive protein, CRP, a key marker of systemic inflammation. These effects, while more subtle than those of aggressive immunosuppressants, are steady and accumulate over time, making niacinamide a potentially valuable adjunct or alternative for long-term inflammation management. In autoimmune arthritis, such as rheumatoid arthritis, inflammation is not only destructive but self-perpetuating. The immune system erroneously attacks the joints, leading to pain, swelling, and eventual joint deformity. Modern biologics, such as TNF inhibitors and interleukin blockers, target these pathways with precision. They are undeniably powerful and, for many, life-changing. However, they also come with a hefty price tag, require injections or infusions, and carry serious risks, including infections and immune suppression. In this landscape, niacinamide's role as a gentler, lower-risk anti-inflammatory option has been largely neglected, not because it lacks merit, but because it doesn't fit the commercial model of modern rheumatology. Another layer of complexity is the inertia of clinical practice. Once newer therapies gain regulatory approval and funding from pharmaceutical giants, older interventions, especially nutritional ones, tend to fall through the cracks. Niacinamide was never aggressively marketed, and its studies were modest in size and lacked the massive infrastructure behind today's drug trials. Thus, its data, though promising, has been largely forgotten in the face of billion-dollar biologic campaigns. What's unfortunate is that niacinamide offers something most modern drugs do not: safety, affordability, and broad systemic benefits. Unlike drugs that target a single inflammatory protein, niacinamide supports the body's own repair and regulatory mechanisms. It's not just dampening inflammation, it's promoting cellular health. Many patients with joint conditions also suffer from comorbidities such as metabolic syndrome, fatigue, or cognitive decline, all areas where niacinamide and its NAD-boosting properties may also provide benefit. Moreover, in an aging population where osteoarthritis is exploding in prevalence, an inexpensive and well-tolerated compound that reduces the need for NSAIDs or corticosteroids could represent a quiet revolution in care. Yet it remains underused, unpublicized, and undervalued. The reality is that niacinamide likely won't replace biologics for severe autoimmune arthritis, nor should it. But its potential as a first-line therapy for early-stage osteoarthritis, or as an adjunct to reduce reliance on harsher medications, deserves far more attention than it currently receives. We need more modern trials, better integration of nutritional science into rheumatology, and a willingness to re-examine old therapies through the lens of new understanding. In short, niacinamide is a gentle but potent anti-inflammatory agent that has been cast aside in the rush toward pharmaceutical innovation. Its role in improving joint mobility, reducing systemic inflammation, and supporting long-term health makes it a tool well worth rediscovering, especially in a medical environment increasingly strained by cost, complexity, and chronic disease.